Experts confused on declining COVID-19 cases in India. When the COVID-19 virus invaded India, the country suffered from the instant rise of cases of about 100,000 per day. This severely affected the country's economic and healthcare sectors, and some feared that its health system might collapse. Then, all of a sudden, the new cases dropped to 11,000 per day. Scientists around the globe wondered about the turn of events. As per the February 16, 2021 situation report by the WHO, the global cases of COVID-19 last week continued to decline with 2.7 million new cases, a 16% drop from the previous week. The same goes for new deaths, having a decline of 10%. In the Southeast Asia region, over 150,000 new cases were reported in the past week, which indicated a decline of 13% compared to last week. 3 countries reported the highest numbers: India with 78,577 cases, Indonesia with 63,693 new cases, and Sri Lanka with 6,276 new cases in the past week. Using those figures, India's new cases in the past week would be a little over 11,000 per day. So, what might be responsible for the plummeting new cases? According to Al Jazeera, experts have suggestions to explain the sudden drop. The biggest suggestion is herd immunity when India experienced massive COVID-19 cases in months. It's possible that more than 50% of India's population have developed some level of immunity against the coronavirus, and not everyone had to endure severe symptoms. The next suggestion is some pre-existing protection against this virus. If the latter is true, scientists must find it to better understand why some people experience severe COVID-19 than others. Whatever they can find may also unlock better vaccines and the long-awaited specific treatments of COVID-19. Of course, the government of India didn't gamble with herd immunity or pre-existing protection traits. Wearing face masks is mandatory in the country that likely helped reduce new cases significantly. People who violated that rule are fined in some cities. Despite the good news, India remains vigilant as everything they've worked for may go to waste with complacency. Dr. K. Srinath Reddy, president of the Public Health Foundation of India, said, "Danger still lurks around the corner." While experts suggested herd immunity, they can't be sure of its scale. Some cities may have reached the 70% to 90% threshold, but others haven't. Thus, the country's population as a whole remains prone to the coronavirus, especially its new variants.